Where National Doctors Day is the same date as the anniversary of the first use of the general anesthetic in surgery. Is that right?
Yes, Ether, Dr. Crawford Long in Georgia.
God bless that man. We ought to, if there is a statue somewhere,
there is.
He deserves it. Don't tear that one down.
Yeah, I hope they don't. And he's pre-Civil War, so you don't know who's going to be canceled these days.
Because prior to that, what was used? A bullet?
What do you mean a
Surgeons
bullet?
had to be
You
fast.
bite on a bullet and you had whiskey.
No, you had to bite on the cloth,
No,
and then you
I
drank
said bullet.
and they poured whiskey down the wound.
Surgeons had to be fast.
Oh, geez.
Literally, quite literally, they had to be fast.
I'm seeing in the war, they used a hacksaw as far as amputation is concerned.
Can we move on?
The survey results show that most patients want their doctors to shake their hands, greet them by name, and introduce themselves using their first and last names when they first meet. I have no idea how this comes up here, but this has got to be pre-COVID. Nobody wants to shake hands anymore.
I usually do a fist bump. I'll say, hi, I'm Dr. Horne. How can I help you? Those sorts of things.
Listen, again, kudos to all the doctors out there. We want to thank our frontline healthcare workers because it's been a heck of a year, all the way back to March of last year.
It's been the most challenging. I started practice. I graduated from medical school in '88, and I started practice in January of '92. And there's not been a moment of that time that is not exceeded by the challenges of the past 12 months. It's just been amazing.
I think what we have to do, we have on Thursday a day of gratitude that we're going to be talking about this. But you have to put it in the context from you and your family and the spouse's concerns for their husband or wife who's a doctor or nurse for that matter. And they're going into a situation early on in this thing when we start getting this avalanche, this tsunami of information. This thing is deadly. It's on surfaces. It may do irreparable harm once you get it. We had no idea. We didn't know at that particular time whether it was going to be more injurious to kids than adults or likewise.
The unknown in medicine in general is one of the things that we prepare for and is the greatest challenge. What's the disease? What's the illness? What's the risk? This was an unknown, not just for our patients, but for all of us in medicine, not just physicians, but as you said, the entire healthcare team. And though this is Doctors' Day, and there's a Nurses' Day, I can't say enough about the entire healthcare team, our nurses, our clinical assistants, the entire team that went like a fireman charging into the burning building. And none of us knew any other way. Those of us like me, somebody said, well, how can you do that? I said, that's what I am. That's what I do. I go take care of people. And if there's risk attached to it, that's what I signed up for.
And as the physician there, you're responsible for a lot of times making those decisions that will affect the nurses and the other healthcare providers. So it was a heck of a lot of not only personal but administrative pressure on you.
Lots of pressure on how to take our scarce resources and allocate them in a way that we could help the most people. So it's really a challenge. And watching out for our families, as you mentioned it, the other thing about Doctors' Day is the spouses of physicians. They sacrifice so much.
Yeah. Talk about the frustration a little bit, too. Every time you had the CDC or somebody in Washington talk about, well, this is not as bad as it is, and you had to change horses a lot. We talked about mask on, mask off. And we're still going through that to some degree.
So the unknowns at the very beginning were the greatest challenge, and we had to trust those who knew more than we did. And sometimes they didn't know enough, and they were making the best decisions they can. I'll give them credit for doing the best they could. One of the hardest things has been, but as physicians, we're trained to be flexible, to be willing to change as the facts and the data change. That's what the CDC did, I believe. That's what I know our state health department. I can't say enough about our Mississippi State Health Department. They have been amazing. And
Dr. Dobbs has been an incredible, I think, an incredible leader through this. And he's come on the air and he's shared it over and over, and he's pleaded many, many times to adhere to this. We have the president now saying that we need to mask up again and talking about the rise, and I think it's 22 states are seeing an increase. Speak to that. Do you think that's because of the spring break, or why is that?
So I don't know. Certainly, we can look at the last few weeks and see what were the risks. Mm-hmm. One of those might be variants that are rising. Another might be behaviors over the spring break. Another might be that as spring comes in the air and people are getting more vaccinations out there, people are taking greater risk. I think, like Dr. Dobbs, I would say let's just keep doing the right things the right way a bit longer and get the embers of this fire completely put out.
The other thing that I would say to that, and it's a little bit scary, but again, we go back to where we talked about early on last March. There's a lot of things we don't know, and if there are variances on this, we don't know. All of a sudden, we find out that those variants are attacking people who've already had the shot. As a matter of fact, both, or if it's Johnson and Johnson, the singular. So, good idea to wear the mask, especially when you're around a lot of crowded people.
None of the things that we're doing are perfect. Masks aren't perfect. Distancing isn't perfect. Vaccines aren't perfect. But when you put them all together and use them consistently, my car has good tires. I wear my seatbelt. It has airbags. It's all these things together that make